Welcome to Family Vlogs, and today I have a very important topic that I would like to discuss with you people, and I'm requesting you to stay tuned up to the end of this video. Today I have a very important topic and all of us should know this. Patient rights chapter. If you come to the hospital for treatment, not only us as clinicians, doctors, nurses, or all health workers have their rights to attend to you, but you as a patient, you also have a right to healthcare system. And this is the first right that I'm going to talk about. And if you visualize this, that is right to access health care. In Kenya, we have public and private hospitals, and it's a right of a patient to have a right to access healthcare. The healthcare shall include both promotive, preventive, curative, reproductive, rehabilitative, and palliative. Right number 2, we have right to receive emergency treatment in any facility. These are laws that govern all healthcare workers and patients in Kenya in terms of their rights. So a patient has a right to receive emergency treatment in any health facility. In emergency situation, irrespective of patient's ability to pay, treatment to stabilize the patient's condition shall be provided. And we find that this is a major problem mostly in private hospitals, but in government hospitals, patients are normally taken care of during emergency and there is nothing they are paying. Now, right number 3 is right to be informed all the provisions on one's medical scheme, health insurance policy. Mostly in government hospitals, we have NHIF that normally helps those who have been registered and those who are paying monthly subscriptions. So anyone who is enjoying the provision of medical cover, who is insured, is entitled to know all the privilege accorded and also entitled to challenge where and if necessary the content and decision of the medical scheme and health insurance policy. And this is very important, and each and every patient should be aware of this. Right to choose healthcare provider. This is the bone of contention. This is the bone of contention. This is the bone of contention. Right to choose healthcare provider. You can come to me as a clinician and refuse or opt for another clinician to see you other than me. It's your right. As a patient, it is your right. A patient has a right to access healthcare provider of his choice shall not be unduly restricted by third parties so long as the provider of choice is qualified, registered, retained, and in current good standing with the regulatory authority to provide treatment for the particular ailment or illness, as long as the choice is acceptable in medical and ethical standards. So all patients must know that they have a right to choose a health care provider, and also a right to the highest attainable quality of healthcare products and services. And we say that every person has the right to the highest attainable quality of healthcare products and services. This is the one that I want to talk about. Right number 6 is very, very important, and this right, if not observed very well, might even lead to loss of life. We've seen conditions that right number 6 is right to refuse treatment. You've come to the facility, you are very sick, perhaps you want to be given some aid, or you have a condition that is urgently taking you to theater and you refuse. It's your right. But listen to this. Any person, patient or client, may refuse, withdraw, or withhold treatment, and such refusal shall be documented in writing by the medical service provider and in the presence of independent witness, provided that such refusal, withdrawal, or withholding does not, remember, does not create an immediate danger to the patient or the health of others, and provided further that the consciousness and competency of the person has been taken into account. Somebody can refuse treatment because of maybe drugs that he had taken earlier, Mostly we see this in psychotic patients, and if at all the person is wholesomely stable and he has refused treatment, then us as clinician, we must document down. And if only if a patient's life is in danger and we are expecting impending death, then a clinician, a doctor, or a nurse can make a decision to save life. This right is normally abused by patients. So patients, you should know that you have a right to refuse treatment, but also make sure that your life is very, very important. If you come to the facility for treatment, as clinicians, we want you to be well and go home while you are walking, not to end up in the mortuary. So do not abuse this right number 6 of refusal of treatment, because we are all here for you. Right to confidentiality, and this is a very bad part to us as health workers. For example, there is no confidential. I will use this as myself. When I was diagnosed with COVID, my father was the first one to know before I knew it, and I didn't know how my father received and who told my father my result that I was COVID-19 positive. So it means even us as clinicians or health workers, we fail in this part. And patients normally tell us secrets that some can break marriages, some can lead to strife and disintegration, but it is very, very mandatory for you as a clinician or as a health worker or as a nurse in general to have the right of confidentiality. Whatever you share with your patient should remain between you and that patient, except when you are consulting another healthcare provider. Maybe a patient has a condition that you need a consultant, or for example, these gynecological issues. Maybe you've seen a patient as uterine fibroids or cancer of the cervix, and you want an opinion from a gynecologist. Then both the two should be keeping that confidentiality between them and the patient. And now it says that they shall be upheld except where consent has been expressly given or disclosure is allowed by the law or in the public interest. Confidentiality shall be maintained even after patient's death. And this is normally now on the side of the family member. If somebody has died, then they want to expose what killed the patient. It's only with consent. And if somebody has died, he cannot give consent. So we must look at this right number 7 very, very keenly. Right to informed consent to treatment. And this is very, very important, and as health workers we normally fail. Sometimes you just call a patient, yes, so and so, bring your Botox, unadunga. You inject even without saying that, okay, this is the drug and this is for example, this is a painkiller, I'm injecting you because of the pain you had. So right to informed consent to treatment, so that the patient can say, yes, I'm okay, I'm well with it, continue. Now, what do we say about this? To give full and accurate information in language one understands about the nature of one's illness, diagnostics procedure, proposed treatment, alternative treatment, and cost involved for one to make a decision, except in emergency cases. The decision shall be made willingly, free from duress. And this is very, very important, because some people normally end up in theater and the consent form was signed, but the patient was not told of the complication. So this is very, very important. In our side as health workers, we must try to give the right information and get the right consent from the patient. Now, right number 9. We have 13 rights. Right number 9 is right to information. Every patient is entitled to receive full and accurate information concerning their health and health care. In addition, every patient is entitled to accept and to obtain information about their health, and this is very important. If you come to the facility, we should be able to tell you the diagnosis we got and how subsequent treatment will be. Some people, perhaps they are very busy, and patient comes within 5 to 3 minutes is through the patient, and the patient is not even satisfied of the treatment that is giving. Now, right to be treated with respect and dignity. This is self-explanatory. There are some people who normally look, some health workers normally look at a patient, how the patient is dressed, how the patient is speaking. In general, if he sees level of poverty, he will not treat you well. But if you are somebody who is dressed well, you are carrying a Lamborghini khaki, he will give you first priority. No, this is not needed. Everybody should be treated with dignity and respect. Right to a second medical opinion. This is very best. You know, I'm very sorry to say this, most of the private hospitals do not give second opinion. If they say you are going for surgery and it is surgery, if they say it is this is the diagnosis, we are going to do this, second opinion is very, very important. For example, if a person has a condition that has not become chronic and even its prognosis is not very poor, you can inform this person a second opinion other than taking this patient to the theater and subjecting this patient to surgery that he was not expecting. Now, right to complain. This is very important. A patient has right to complain, yes, but this is now to you. Everybody is a patient, even me. I have a right to complain. But how do you complain? There is a day I was on duty and I felt so bad because there's a female who complained, and the way she was complaining was not right at all. This is the scenario. I was busy attending to a patient who was a road traffic accident with motorbike. He had a very big cut wound on the left thigh, very big one, and I was in the process of suturing. And you know, our patient, we are very busy. Everybody was very busy. The nurse was busy with injections and managing. In fact, to be specific, was managing a patient who has a blood pressure of 200, but wanted preparing this patient to go to the ward. Then a patient came, a man who had a cut wound on the head, a very slight one. The way her daughter complained, making noise, even abusing us, we took it lightly and we continue managing and then after that we managed that patient very well and everybody was happy. So if you are complaining, if you are a patient, this is your right. Yes, you have to complain, but complain in a very respectable way. What do we say about it? Every person has right to complain about health services to the relevant authority, whether somebody has attended you well, whether you are not satisfied. Such complaints should be investigated and receive a response from authority within a reasonable time. That does not exceed 12 months. You know, there's a time frame, particularly when there's a big problem that is involving the management of patient. Where there is a delay, the relevant authority shall provide the reasons. So this is very important. And to our patient, including me, let us complain to our clinician or our health workers in general in a better way. We both came from somewhere to be a health worker. We didn't wake up one day and we decided to be a health worker. This is a call, and we should also be, as much as you have your rights, we should also be accorded the respect that we deserve. Now, right to insurance coverage without discrimination on the basis of age, pregnancy, disability, illness, including mental disorders. Yes, there's a patient who is coming in. Now, this is very, very important. If you can be able to access insurance, then and you're able to pay. For example, mostly in government hospital we use NHIS, National Hospital Insurance Fund. If you can be able to pay that as little as 500, it should not be discriminated, whether you are disabled, whether you are pregnant, whether you have chronic illness or mental illness. I'm happy about what the government of Kenya is doing in terms of pregnant women, provision of Linda Mamas. They have the right to do so. And in this, I also urge people to venture and start paying National Hospital and Insurance Fund, because sometimes you come, this is a government hospital, there are some drugs that you must buy, but you prescribe this drug, the patient goes to the pharmacy, he doesn't have money. But some comes, he is having National Hospital Insurance, there is nothing that we are going to ask him in terms of, or her in terms of money. So, my viewers, make sure that you have NHIS. Lastly, the last right, there were 14 rights. That right to donate his or her organs and or any other arrangement wishes upon one's demise. This one is very serious, and it depends with the community and taboos revolving around community. I may die now, and I can say before I die that if I die in my will, let my bones be used to teach medical students. I have a right to do so, but this is controversial because of the taboos and community beliefs that surrounds us in general. So every person, patient or a client has a right, and these 14 rights that I have said, let us use them in a very, very considerable way, in a way that will help us to manage you as a patient. Remember me, I'm also a patient, and you also accord the clinicians, nurses, doctors their respect they deserve, and we will be living wholesomely well as long as we know all these rights. I made this video to enlighten the community that patients also have rights and they have to complain if there's a problem. If you like this video, give it a thumbs up, subscribe, hit the notification bell, and subscribe for more videos that I will post. Thank you so much, and may God bless you as you have a wonderful evening or a wonderful day. Muchas gracias.